Good evening, everyone. Present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Vijay Varat. Sir is MBBS MD consultant allergist, pediatric pulmonologist, clinical immunologist, consultant at Sai Allergy Asthma Eye Hospital. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is bump, breath, and breakout, safe prescribing for cough, asthma, and itching in pregnancy. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, sir.
Thank you for the introduction. Thanks always IGCP Med Talks for giving the opportunity to discuss my practical experience of 25 years in this field. And considering the intolerance which is developing into the next generation, even last 3 decades, more than 30 years, we are seeing a lot of upsurge in allergies, ranging from children to adults to adolescents. And even during the pregnancy, it has been found that 30% of the pregnant women they continue with the same allergy. 30% have a very severe allergies, including asthma, skin allergies, eye allergies, obstructive sleep apnea, gut problems, fungal infections, eczemas, and 30% may reduce also. So even practically, I have seen like today only one patient was there. So in between, after her pregnancy, her urticaria and all had gone. Now she came with, she's around 47 years old. She came with a severe anaphylaxis to prawns. She had some prawns in outside restaurant, and the additives sulfites into the prawns triggered it, and she had a severe anaphylaxis. And when we tested for her, she had a multiple sensitizations with dust mites, pollens, insects, animal danders, and pigeon feathers. So her sensitization was continued in spite of her symptoms were relieved, but now she came with anaphylaxis. So considering these things, like even 30 years back, once in a blue moon, in a 6 months, one anaphylaxis case used to be there. But nowadays we are having a lot of patients which are having a significant severe allergies. So we know from head to toe, from seborrheic dermatitis to hair loss, dandruff, to sinusitis, headache, migraine, to throat problems, even repeated cough, clearing of throat, ear problems, eye allergies, rubbing, blinking, discharge, reddening, to fungal infections, the axillary area, nape of the neck, below the breasts, in the inguinal regions or arms or legs, to asthma, to chronic respiratory disease. These are increasing only, and drug reactions and food allergies are also very important now. They are also increased because many of the patients are referred to us considering the patient has a significant drug allergies. What to do during the pregnancy? I still remember there was a homeopathic doctor, and during her first pregnancy, she started with the multiple drug allergies, and she had abortion. Even post that, she had a COVID, but none of the doctor touched her because she had a even allergy to paracetamol. So she was brought to me. Her husband was a neurosurgeon, and when we did a testing, she had a multiple sensitizations. Then we gave her omalizumab injections, 300 milligram, for 4 to 6 months. She conceived the second time. She continued the pregnancy with the allergy management, even desensitization, allergy vaccines also we continued during the pregnancy. Before the pregnancy, if you start the allergy vaccines, it can be continued for during the pregnancy. She conceived and the child is also fine, and she tolerated very well. Then even the whatever during her next, she underwent a cesarean also, and she required IV antibiotics and all. She did not trigger it. So overall inflammation of the body increases, and the sensitivity level has increased. That's why the allergy symptoms have progressed to multiple things. So while managing the patients, if the patients during the pregnancy are given a first generation antihistaminics in a higher dose or something, the baby also can have a side effects. And because of the first generation antihistaminic sedation, sometimes the mothers also have accidents, and falling on that, on the stomach or something, the abortion can happen. So many things are there. So allergy symptoms, as a practitioners, I think we all know that. But most neglected is the ocular allergy, the dark circles, denim organ folds, watering or itching, and that's missed. And many of the people they feel that It is a habit, and that is missed. And then the patient go into a severe allergies. Rest of the others like upper airway cough, the people just have a just mud or some of the other Vicks tablets or something. They try to soothe, like Kantasudharak tea or something. But the inflammation continues. And one fine day, at a peak point when more care is required in the second or third trimester, they have a severe cough and then has a problem. Many of the women I have during the second or third trimester, refractory cough, which is not responding even to the inhalers. So because the dust mites into the bed, which are in crores, like daily we shed around 1.5 gram of skin, and 1 gram 10 lakh dust mites survive. So the patient which has a sensitivity to the dust mites significant or the pollens, and if there is a flowering season during that time, and because of the hormonal changes during the pregnancy, the sensitivity goes very, very high. They don't respond to that, and then that time we can't give oral and parenteral steroids also. It can be harmful to the child. And even there are studies done now. Even during pregnancy, the mother is at least allergy tests are done, and some simple precautions if it is taken to the mother. So the next generation has a lesser severity because now the severe eczema, anaphylaxis in the children's childhood asthma in Pune like city, more than 40% of the children are having asthma. At houses, घर घर मोदी जैसे बोलते थे, वैसे ही घर घर में nebulizers हो गए हैं. So considering all these things, when the next generation is having a more severe allergies, even ocular allergy, lot of rubbing and all, we are getting a lot of keratoconus in early stage because of the repeated eye steroids, early age cataract, glaucoma. So as a gynecologist, even you are responsible that if you educate these patients, the next generation will have a severe, less severe allergies, and later on the continuation will be less, and the complications will be there. So number of allergens are there. Still, the people have a misconception about dust allergies, but actually the dust mites are there. Then the pollens, insects, even their dried feather and the droppings, even the pigeon feather droppings, animal dander, molds, medication, drugs, latex. Latex sensitivity, if it is there, then these people are cross-reactive to the fruits and vegetables. So many of the patients they complain about that after eating lemon or orange or any grapes or something, they have a problem or ice cream and all. And during pregnancy, you all know these are the favorite foods for the mothers. And if they are sensitive to that because of the cross-reactivity, they will be always complaining. So these patients, if we do the proper testing, if the latex sensitivity is there, we guide them about that. So for primary sensitization, the gut inflammation will reduce. Even there are studies now where it has been found that the these airborne allergens and the pollutants which are swallowed by the people, they go to the gut, they cause a gut mast cell sensitivity, eosinophil sensitivity, and because of that, again, because of the cross reactivity as well as the gut mast cell sensitivity has increased, and the hormonal changes, these mothers when they eat something or the medications, they get a trigger. So the while managing these patients, the proper standardized accurate allergy tests are important. Whatever the advertisements are done in the newspapers and they advertise, they are not useful by the laboratories also, whatever they say. The proper allergy specialist opinion. After that, the selected allergen testing is very important. Recently, just few days back only, there was a case from one of the very good hospital at Aum, Cloud9, and the husband came to me because she was planning to conceive, and she had some endometritis or something. Some antibiotic was required. She was given an injection taxim and she had anaphylaxis. So why it happened? When I took a detailed history, the husband had been there with the just files. When I asked detailed history, then he said, yes, no, since childhood she has a seasonal rhinitis, sinusitis, dust allergy is there. Otherwise, she doesn't have any medicine allergies. First time she has. So because of her, whatever the procedures and the medications, her sensitivity increased. And that's why she had a significant anaphylaxis to that. So we explained to them, now after the procedures, she will be coming back. Then we will do the standardized allergy test and we will manage the primary allergy so that the sensitization and the overall inflammation, including the gut inflammation, skin sensitivity comes down, and the patient has a significant relief for that. So if you see the different type of allergies and the different type of symptoms, we all know that. But practically, I have seen that during pregnancy, many of the patients has a drug allergies, skin sensitivities, then asthma 30% increases, upper airway cough syndrome, sinusitis, migraine. These are very common. And some of the patients during the procedures, like when I take a lectures at Kolhapur, I had a lecture. One of the doctor from Palus, he said, like when they were draping, the woman had a betadine anaphylaxis. One patient post surgery, sopramycin something was applied. Sopramycin anaphylaxis was there. So the sensitivity depends on different patients. Each and every thumb is different. So same way, the sensitivity should be there. And similarly, the preservation should be there. So the genetic tendency, the additives and the preservatives, then artificial fertilization, then pesticide use, and lifestyle changes. So, like as I mentioned, even hair loss to dandruff to so many things, conjunctivitis, then upper airway, the skin irritation. I think you must have also seen many of the women they have urticaria, eczema during that increases, cholinergic. So this is because of the mast cell hyperactivation. And eczema also increased. Many people I get post pregnancy, during pregnancy, and then this gut sensitivity, gut brain axis, gut skin axis also is there. Then allergic contact dermatitis. Even post pregnancy, many of the women they have it is disturbing to the mother. So again, very safe medication should be given. Practically, then swelling of the eyes or like hands or fingers, joint pains, joint swellings. This can be also because of the angioedema. Then hereditary angioedema has also been like just few days back only. I had a patient from Raipur, and that young woman, 27 years old, after the pregnancy, she has started with hereditary angioedema. Now one-sided swelling, eyes. Sometimes she has a throat problem. Sometimes she has a genital edema, foot edema, and so this hereditary angioedema may be triggered by the pregnancies. Then depending on that, you can see the inflammatory changes, melasma and all that also increases, the upper airway cough, and skin problems. Even many people have psoriasis and autoinflammatory. So allergy, immunology, autoimmune disorder, it's all connected. So this can be the pictures into that. And then because of the pressure and the sweating and all, that also triggers. And then the cross reactivity, or some of the patients have a actual food allergy. So how to differentiate it? Food allergy means after eating some foods immediately. At home also, if they have, then it is a food allergy, even a smaller amount. But if they eat outside, then the additives, preservatives, biryanis or Chinese or tandoori or some of the other colors and all, they trigger the things. Then you can see the lower body, then vasculitis also some of the patients you can see in this picture. The discoloration will be there after the hives and all. Then generalized symptoms, anaphylaxis is very common, the dizziness, and it will be more serious because the pressure during the anaphylaxis attack, it will have abortion also, and then if it is a very life-threatening, then it is risky to the mother also. So depending on that, the dysregulation of the immune system which happens into these patients, or to manage the sensitivity, it is not a lower immunity, it is a hypersensitivity disease. So if you see, the interleukins have been a very important role into that, and then the FCR receptor and the mast cells, the specific IG for the specific allergens, which trigger the mast cell basophil eosinophils. The inflammatory mediators are released, and then the patient have a. So we have a significant allergen database, and we have last 25 years in Pune, we have identified the Prosopsis, Sarkari Babul, we call it, then Samania Saman, then Oloptella, Peltocorum, plasmides, molds, and then the different type of epitopes for the specific foods. So depending on that, we have to do the CRD test. Now it is a component result diagnosis advanced allergy test where we can identify the specific epitopes, specific proteins for these allergens, and we can manage with that. So there are definitely immunotherapy which can be a long-term disease-modifying therapy which should be utilized into the community so that the before pregnancy, if the mother is supplemented with that and she has been treated properly, the Th2 inflammation to the mother comes down, and the severity of this 30% of the patients which will be having that, and will definitely it affects the quality of pregnancy, and it affects the baby also, and the next generation also, the severity that can be reduced. So during pregnancy, again, the safe antihistaminics should be preferred. So which one? Like levocetirizine, desloratadine, fexofenadine, bilastine, avastin, and olopatadine. They are very safe. Even they can be given, not the first generation antihistaminics. Even the fexofenadine, bilastine, and all can be given in a higher dose also to these patients. So depending on the exacerbations, we have to add on these medications. Even suppose the fexofenadine up to 720 milligram, some of the mothers may require it. Then add on levocetirizine once in the evening time because it may cause a sedation in the daytime. Then ibastine and all you can add after 6 to 8 hours. Elastine also 20 or 40 milligram depending on the things. Then along with that, the nasal douching is also very helpful in these patients. A good moisturization to these patients. Even every pregnant mother should have a very good moisturization because the dust mites and pollens they can penetrate through the skin also. So even during the pregnancy, many of the mothers have a significant dryness and all. So that is one of the atopic dermatitis. So the good amount of moisturization definitely helps them. Then the dietary recommendations, the foods with omega-3 rich foods, probiotic rich foods, antioxidant rich foods, folate rich foods, and supplements can be given to these mothers. And depending on the tablets also, some of the tablets they may not tolerate it. So the capsules are the containing the salts and preservatives, additives into the tablets, or to see that those with a less colors, less additives, and this can be like a yellow color into the tablets may cause a trigger to the many of the patients which have a primary allergy. So depending on that, now problem is that the foods are so much pesticide use. It is very difficult to have organic foods and all. So they require a good supplements also. So in some of the study-based guidelines are there. Avoid excessive sugar, reduce the stress, avoid exposure to toxins, vitamin D supplements, probiotics during the second or third trimester. They help to the baby also if there is a significant family history. There are some research-based probiotics like Lactobacillus rhamnosus GG, Lactobacillus salivarius, then Lactobacillus bifidobacterium. These are there, which are very well studied during the pregnancy also. They can be used. Then I mean, nowadays the younger generation mothers they should be strictly asked about not to smoke, healthy weight, then have a good sleep. Also, that is also very important. And as I mentioned about that, allergen immunotherapy, which is a primary prevention, we stop the progress into that mother also before the pregnancy. If we start the mother on that, it helps, and that awareness should be that these are available in more than 150 years into the community. They are very safe and before the pregnancy, if the mother is on that, and specifically sublingual immunotherapy now, the subcutaneous one, other than that, now there is sublingual immunotherapy. One tablet form immunotherapy has been for dust mites recently. In October, we had been Denmark, and recently last Saturday, Sunday only, we had a meeting in Mumbai about that. They can be given in allergic rhinitis, sinusitis, severe food allergies, or atopic dermatitis. And some guidelines are that if their mother is high risk for that, and another elder sibling had a significant atopic dermatitis anaphylaxis, even the next gen sibling in an early stage, 4 to 6 months, the winning some of the foods can be introduced early so that they don't develop a severe food allergies. Now, the sublingual immunotherapy, you can see how that acts at the different level and the TH2 to convert to TH1, then interleukin level, then they help to reduce the mast cell and inflammatory mediators. So, possible mechanism is that the production of the IgG1, IgG4 antibodies, reduction in the specific IgA, reduced recruitment of effector cells, altered helper T cell cytokine balance, shift to TH1 from the TH2. T cell energy, B cell suppression increase, regulatory T cell functions. So there are inflammatory mediators during the pregnancy, and this TH2, which is helpful in some of the patients to reduce the inflammation to have a good placental binding, but some of the patients, 30%, this TH2 inflammation increases in a lot, so that the mother has a problem and the baby also. So now identifying the specific allergens, then treatment with the safe antihistamines, then allergen immunotherapy can play a very good role to stop the further progress. Even 2018 systematic review has shown that if the mothers are treated properly, the newer generation, the severity of the allergy goes down, the inflammation goes down, and these targeted therapies like omalizumab before the pregnancy, if the mother has a significant anaphylaxis or urticaria angioedema. Even nowadays, the dupilumab has been introduced in a severe asthma with ocular allergies or severe urticaria. So they have interleukins 4 and 5, 13, where the targeted therapy helps to reduce the inflammation and it saves the baby as well as pregnancy also. So there are clinical studies where the good moisturization, prophylactic emollients, antihistaminics, probiotic diet and good diet and reducing the stress, you're doing some yogas and which can stop the atopic march and further complications. So as I mentioned, a significant amount of moisturization during pregnancy also alterations in the microbiome, the DH2 targeting therapies, immunotherapy, and safe antihistaminics like fexofenadine, bilastine, desloratadine should be prescribed than the oral generations. Then, as I mentioned, depending on the immunodysregulation intolerances, we have to regulate the immune system, the control the inflammation, so that according to the genetic factors, environmental factors, and these biases, we have to treat with the safe one. So personalized treatment plan should be there in each and every patient. So according to the clinical history, then specific allergen testing should be done. It's very safe during pregnancy also. It does not cause any side effect, but because we are just putting the allergens in the capillaries, which are smaller than the hairs, we are just introducing less than 0.03 ml of allergen over there, and just minimum like a mosquito bite, small in duration, and hardly per allergen 100 rupees is the test. So nothing as compared to the whatever the advertised blood test, so much costly and the false positive reactions. So standardized skin test is the best one. Once we identify the specific allergens and avoidance measures, and then it will require a lesser antihistamines also, lesser inhalers, lesser nebulizers. So it will save the pregnancy and it will not have other side effects also to the mother, because overuse of nebulization or higher dose may have a hypertension also to the mother. It will cause a problems. So once allergy is always allergy till we don't manage it properly, and to stop the severe food allergies, anaphylaxis, to improve the quality of life, to stop the chronic respiratory complications, and as the allergic march to stop it. Awareness should be that, and the preventing the allergic march requires a multifaceted, multidisciplinary, and multi-specialist approach. And as a gynecologist, it's a big role to manage these skin allergies, asthma, throat problems, upper airway cough syndromes, migraine, sinusitis, and all with the safer medications. And if these mothers are treated properly, the next generation also has a less complications. So our atopic march stopping should be there. And then depending on that, even the newborn baby, what type of bath should be given? The bathing practices have changed. So last year with the World Allergy Organization, American College of Allergy, the bathing practices, reviewer I was there. So a lot of things are there. Even vernix caseosa should not be cleaned immediately. Then the baby should be given a very less bath depending on the severity of the atopic march into the family, and good moisturizations, specific research products, the soaps or something, and which are the required food allergy. Early introduction from 4 to 6 months, the foods to the baby. So, as a gynecologist, the role is important, but why the allergist play a very important role? So, according to the proper history, around 2 to 3 hours, one patient takes for that. Then, after as an allergist point of view, the clinical examination, then specific standardized allergy testing, not the panels and all. Then simple avoidance measures, we guide them. A safe antihistamines, very few times oral or parental corticosteroid. Other than nasal steroids and the inhaler steroids are safe. Then bronchodilators, very less we should give. Then monitoring, regular follow-up, proper symptom tracking, and if required, IgG1, IgG4 antibody titers will be done, and then collaboration with the primary care physicians, gynecologists, pediatrician, dermatologists, and the practitioners. As I mentioned already, the less allergenic food, organic foods, and future perspectives are a lot. We have to be together to stop these genotypes, severe allergies, because people suffer a lot. Severe allergies because people suffer a lot. The baby after milk consumption, the child had a bloody diarrhea. Then she had once kiss the child with having a tea with the milk. He had angioedema and all such a sensitivity is there. So these are always on the foot war, like they are scared about anaphylaxis. A lot of cases we are getting now. Twice a week, one patient at least I'm getting of anaphylaxis. So this atopic march should be stopped. And while that, considering this so many medications we are using, but the World Health Organization has said that allergen avoidance and immunotherapy are the only treatments that modifies the progress of the disease and further sensitivities. And even if you see all the guidelines worldwide, the avoidance measures should be educated, and all these conditions are there where the allergy testing can be done, and it can prevent the complications into the patients, and it will reduce the nasal and ocular throat symptoms, skin problems. And as the patient grows, even after the pregnancy also, they have more complications at the age of 65 also. I get so many patients with VKCs having a difficulty into that. Food sensitization is less at the pregnancy, It's more cross reactivity, and after the diagnosis properly, and the standardized skin test, which is much better than the non-standardized one which are practiced for that. And beyond the pharmacotherapy, the 2017 the Indian College of Allergy Asthma Immunology, where I was also the faculty into that, and here the focus history, avoidance measures in indoor and outdoor pollutants like dust mites, then specific precautions. The humidity can also be, then air purifier wherever required, or into the car the pollen filters can be used, then dust mite proof bed coverings, this can be guided. So, and this disease modifying immunotherapy, which has been very well used in all these cases of IG mediated diseases. And then some of the patients will have serum sickness syndrome or something. So that also can be useful if during after the pregnancy, if the baby has a severe hyperbilirubinemia, or suppose you are giving some plasma products and all, and the mother has a serum sickness, then, and it can be really useful for a long term for the prevention of nuisance sensitizations, further complications into the mother, as well as severe food allergies and complications. So even we have published many articles, and the moisturizers, specific soap precautions, inhalers, and second generation inhaled corticosteroids, as well as oral these loratadine and all, they are much better than that. So considering these things, the gynecologists have a very important role, not only to the mother, even to the next generation, the babies and all. And coming together, we should stop this allergic march leading to the chronic respiratory diseases. As COPD is the second death causing disease in India, and many of the mothers are treated symptomatically, but later on they go into these all complications, including the ocular allergy, obstructive sleep apnea, then the COPDs and all, and then secondary eczemas, urticarias. So we can stop this progress and help the people, and considering the awareness amongst the community and the multidisciplinary approach by different type of, so even the central part is allergic rhinitis, so we should educate the patients properly, and 360-degree approach is required. So there are a lot of research, more than 100 years the ALK has produced the dust mite desensitization, grass pollens, insect desensitizations. In India, why they don't come? Because the awareness is lacking and they are not using a proper medication. So coming together, we can make a difference to the community. Thank you. Thanks a lot.
Thank you so much, sir, for this wonderful presentation. We do have some question if you like to take that up.
Yes, yes, please. Yeah.
Yeah. So, sir, the first question is,
Mhm.
yeah, just a moment. Yeah. It is, what is your protocol for managing acute asthma in labor or around the time of delivery?
Actually, around the time of delivery, there is an acute asthma. The best way is a nebulization that time, because that is already the patient is having a severe spasm, and she is compromised, and the baby again compresses on the airways. So there the inhaler may not reach to the lower airways and all. So acutely nebulization is the best one. And still doesn't respond, then sometimes the short course of one IV steroid also can be helpful, because that does not harm the baby, rather than it will benefit for the lung development also. But I will say ki rather than this acute asthma attack and all, if the mother is monitored with the excel nitric oxide phenotypes nowadays, there doesn't require more efforts. Just it has to be normal breathing into that. And if there is a persistent inflammation to the airways, they can be put on the preventive inhaler therapy, so that they don't require a acute attack during the pregnant delivery or labor. So that such type of rescue therapies should not be required, because always when we are using a high dose, there are always chances of palpitation, blood pressure, and so many things.
Next up, sir, how do you differentiate between beginning pregnancy related itching and serious condition like cholesterolysis?
Yeah, it's a very common problem, and we get a lot of patients for during that time. So practically, the itching is very difficult, and the mother is disturbed. So there, a good moisturizer. There are very safe anti-itch lotions available, even the non-steroidal one like Utixira, Artiplex lotions and all. There are some good non-side effect, such type of non-specific, where there may not be a primary allergy, but the cholestasis is there. So tablet Utixira or Artiplex also can be used. And then depending on that, the safe fexofenadine or bilastine in a higher dose also to control the histamine levels. So that way we can manage it.
There's one last question, sir. How do you handle cases of atopic eruption or polymorphic eruption in pregnancy?
Yes, these cases are also a lot there. If there is a severe itching, as I mentioned already, those things happen. And only some eruption is there. If there is no itching, and if it is not disturbing, many of the patients they resolve also after some time, whatever the trigger may be there. So we have to find out any dust or any foods, additives, preservatives. So start taking precautions on that also, rather than giving a higher medications. And then most of the patients they recover with that, with a good dose of hexofenadine or bilastine and all. Very few require a further, like even now toxicity cream has come. It can also be used. Suppose there is a inflammation significantly, and then some very good safe anti-itch lotions also. So most of the patients they respond with that.
Thank you so much, sir, for answering all our questions. That's all from our audience. Before concluding, sir, any take-home message from your end?
Already see, as a practitioner, as an allergist, we are managing all the serious cases and all. But as a gynecologist, the role is very big, not only symptomatic, because these patients next generation are going to have a very severe allergies. Last 4 years, when working with the World Allergy Organization Allergy Prevention Committee, there are guidelines that if the mothers are not treated properly or parents, their generation is having a very severe allergies, very severe eczemas, anaphylaxis, food allergies, and asthma and all. So, if the gynecologist before the pregnancy or during the pregnancy, if we can pick up the hidden signs to the mother like dark circles, many of times there is a misconception because of pregnancy, the dark circle. It is not that way. It has been found that it is the allergic inflammation from nose mucosa which is connected to that. Then long eyelash, Denny Morgan folds. Many of the mothers will do this way rubbing and all. Then any throat posterior pharyngeal hyperplasia, any obstructive sleep apnea, or any childhood history. So there has to be a form actually, the allergy questionnaire. And each and every pregnant mother or before pregnancy, they should be filled with these forms so that the emergency complications can be prevented because it is hazardous to the mother and baby also. So it is not a one life, but two lives are affected. So that awareness, if it is there, we can prevent a lot of complications.
Thank you so much, sir, for this wonderful session, and thank you for joining us today. With your permission, I would like to conclude today's session. Thank you, sir.
Thank you. Thanks a lot.